Everybody. Today is the 27th of May, 2021, and I'm delighted to welcome you back and welcome some people for the first time to our fourth Masterclass series in neurodiversity. These are a series of online seminars, talks, chats, or discussions on the topic of neurodiversity and very much taking it from a strength-based perspective. So they happen the fourth Thursday of every month. The idea behind them really is so that we can share ideas and knowledge and generate a discussion about neurodiversity with the ultimate aim to improve the experience of individuals with neurodiversity, whether it's in school, education, occupation, or just in terms of community living and enjoyment. My name is Fiona McNicholas. I'm a child and adolescent psychiatrist working in clinically, but also working in University College Dublin. And along with my colleagues, Beth, who is on screen with us today, Ken from ADHD Ireland, NUI Maynooth, and Andrew Eddy from Australia, we have set in motion an international neurodiversity working group. Again, with this aim of encouraging individuals to join with us and to help us in our learning about how can we make our society better. With that in mind, UCD has set up the Neurodiversity Project, and we're very much focusing initially in our own backyard, so to speak. And this project has been very, very much influenced by our speaker today. So I'd like to welcome Professor Lawrence Fung, who is an assistant professor in child and adolescent psychiatry at Stanford University in Palo Alto. Lawrence is a consultant in child and adolescent psychiatrist. He has a clinical and a research interest in the neural basis of social communication difficulties and cognitive functions. He's director of the Stanford Neurodiversity Project, and that really is what inspired and excited us at UCD to take this forward. Lawrence, I know in your bio that you say you're a dad of a neurodiverse teenager, and I'm sure that has been both tremendously instrumental in helping you set this up, for which we're very grateful, and gives you a very unique perspective. So I look forward very much, Lawrence, to your talk today, which is neurodiversity in higher education.
Thank you, Professor McNicholas. It is quite a kind introduction. Today I'm going to be focusing on neurodiversity in higher education. So let me share screen here. Can you see the slides okay?
Yes, that's good.
So in the next 20 minutes or so, I'll give you some background on neurodiversity and neurodiverse individuals in higher education and what we are doing at Stanford with our neurodiverse students. It's a series about neurodiversities, so there's no need to belabor this, but just to say what we are conceptualizing neurodiversity at Stanford is really about a concept rather than an entity or a group, or it's really about a concept of regarding individuals with differences in brain function and behavioral traits as part of normal variation in the human population. And when we talk about neurodiverse conditions, we would include conditions such as autism, attention deficit hyperactivity disorder, dyslexia, Tourette syndrome, and many others like epilepsy and so forth. So neurodiverse conditions are very common, as we know that autism has a prevalence of 1.9%, much higher than 30 years ago when it was considered as a rare condition. Dyslexia is much higher, 13 to 14% in the United States, and ADHD is about 5 to 7%. How many autistic students are there in higher education in the United States? It's about 0.7 to 1.9% according to this paper and other papers as well. Basically, it's very much consistent with the general prevalence. In terms of the trajectory of autistic students in higher education, what we know is that about 32% of them will enter higher education in the United States, but only 12% would graduate. Unemployment for autistic college graduates in UK are much lower than the neurotypical graduates. Neurotypical graduates had only about 5.5 unemployment rate. Graduates with disabilities is 7.7%. Much higher in the autism population, 18.5%. And this really calls to the need for improving these outcomes, and therefore specialized employment program would be needed. This Stanford Neurodiversity Project has been designed to empower the neurodiverse population, and the first thing that we really are trying to do is to establish a culture that treasures the strengths of neurodiverse individuals. If we do it right, then we can empower neurodiverse individuals to build their identity based on their strengths and interests, and this can last for a lifetime. In the beginning of the project, we are focusing on Stanford, so we attract talented. We want to attract talented neurodiverse individuals to come to Stanford to study, and also attract talented neurodiverse individuals to work at Stanford and also our partnering organizations. We train talented individuals to work with neurodiverse population, and would like to disseminate the model as widely as possible, and ultimately we would want to maximize the potential of neurodiverse individuals, neurodiversity, potential of neurodiversity, not only for the neurodiverse individuals but for the society as a whole, because there is a lot that neurodiverse individuals can bring to the table. We definitely want to focus on the neurodiverse individual, a person-centered approach, but really is in order to make the project work, we have to focus on, we have to really take into account all the different components of the ecosystem. Family, friends are typically the closest to the neurodiverse individuals, but there are others like the mentors, the therapists that can be making changes of the environment for the good. In the education setting, teachers, coaches, classmates, roommates can make the environment neurodiversity friendly, and the school officials, school community at large can also make the environment different through various different opportunities. And similarly for employment setting, supervisors, job coaches, colleagues, executives, work community, and other supporting communities can collectively make the environment more neurodiversity friendly. So our project has three major initiatives: Neurodiversity Awareness and Education Initiative, Neurodiversity at Work and Wellness Initiative, and Neurodiversity Independent Living Skills Initiative. And there are multiple programs that we have already implemented within our project. I'm going to focus on the Neurodiverse Student Support Program today. And we are not really the only group that has implemented specialized employment program for students on the spectrum. There are roughly 80 programs that we know of in the United States that have been supporting students on the spectrum with all different ways. So this paper has listed some of them. This is actually not a complete list. From what we know in this 2020 paper by Wiesel, the number of programs that are providing academic coaching is about 50%. Peer mentoring is just about that. Vocational support is also up there. And specialized employment program with mentor check-in only is 38%. Social skills intervention is about 36%. And there are some other services that are also included within the various programs, but these are the top services in most of the specialized employment, specialized support program in American colleges. And this slide basically tells you about the utility of the support services. It is a rather small sample, so take it with a grain of salt. But academic coaching is up there. Transition program to college from high school is about 70% of these 23 students. Tutoring is about 2/3. The writing center to help the students with writing is more than 50%. Counseling is about half. Mentoring by faculty is half, about 1/3 for the peer mentoring. Support group only 1/4, and social skills group 1/4, and self-efficacy training is only 9%, which is really surprisingly low. So with all that in mind, after doing our homework over the years, we have built a neurodiverse student support program for our students on campus. It has many components in this program, and I'll briefly describe them to you. So we train peer mentors and residence assistants on campus to help students with transitioning to college from high school. We also train the peer mentors to help the students with independent living skills and social skills. We collaborate. We also have an affinity group that's run by our coordinator as an additional means of helping the students. We collaborate with the Office of Accessible Education for Accommodations, and we also collaborate with the Schwab Learning Center for learning support, the Career Center for career development support. As a psychiatrist, I direct the Adult Neurodevelopment Clinic, and we collaborate with the Vaden Health Center together to provide mental health support. We also teach. I teach a couple of courses in neurodiversity, and basically they are the backbone for trying to get our community have more knowledge about neurodiversity, and all students are welcome to take the classes. In terms of the peer mentoring program, we have current and incoming students that are paired with upperclassmen who are peer mentors, and this can last for the entire academic year. The students and the peer mentors, they work through a curriculum that we have designed, and also the initial work actually was done by Valerie Paradis, who has worked in the area of mentoring for a while, and that she had collaborated with us to make the program more focus on helping individuals that have autism. So she herself is on the spectrum, and that really helps us to start from a perspective that is deep in terms of the perspective from a person on the spectrum, as well as someone that has developed programs. So we're using this curriculum. We help the students, student mentors, to understand how they can help the neurodiverse students. So the mentors, they also receive like about 5 to 8 hours of training every week. They receive supervision from our program manager. So there's a lot of oversight in this peer mentor program, and we believe that this makes a big difference in terms of getting students really customized support. Every student is different. Every student needs different kinds of support, and this program will be able to be more flexibly meeting the needs of the students. We also have the affinity group that has rather informal gatherings, and every week or so they get together. The students get together, and most of the discussions are really unstructured. And this way, we are finding out that there are a lot of different additional means that we can help the students with. And the neurodiverse students also have the platform GroupMe. It's an app that the Stanford students use, and they communicate with each other, and the communication was also facilitated by by our program coordinator. The class that we are teaching mainly is really about understanding neurodiversity better and exploring how differences enhance and contribute to the richness of the human experience. Here are the topics that we talk about. It's only a sample. We have probably like about 35 topics that we have talked about in the 3 quarters in the year. This year, because of the pandemic, they are all done remotely, and we are using an asynchronous approach this year. Next year, we're going to be using not asynchronous. I also teach this design thinking course in neurodiversity, using the standard approach of design thinking that's developed at Stanford. We have the students basically design various different projects that are related to the advocacy work that can be done in the field of neurodiversity, or it can be related to specific topics in employment, such as this one navigating the such as this one improving the manager-employee relationship in performance reviews. And there are also projects that are focused on the campus environment, like the navigating the accommodations process and social inclusivity training. Both of these turn out to be very highly successful, and we actually use the materials even for our own neurodiverse student support program, and materials that are being produced are actually used by other offices on campus. Within our neurodiverse student support program, the first year, 2 years ago, we had actually 5 students participating. Only 3 of them went to the transitional orientation. we had 17 students in this academic year, in 2020 to 2021 academic year, and about 15 participated in the transition orientation. This is a very important time for a lot of the new students that don't know anything about Stanford. So having that small group to help the students is highly important. As you may know, generally for most colleges, the orientation involve many students, hundreds to thousands of students. So having this small group is definitely more beneficial for our neurodiverse students. Peer mentoring in the first year, 4 of our neurodiverse students were asking us to help them with one-on-one peer mentoring. In the second year, there are more, because we also have more students that the demand was basically tripled. So we had students that are needing more weekly support, and some just need less mentoring support. The mentors also gave us feedback on how things are going. Generally, their interactions are rated as well or very well, and generally the mentors rate the cases that we are using as very helpful. The mentees are also extremely satisfied with their transition as a student to the college experience at Stanford. In particular, with the mentor-mentee relationship, the mentors feel their relationships they're extremely pleased with the relationship. There are a couple of people that are somewhat pleased, and a couple of people are neither pleased nor displeased. So overall, nobody was feeling like the relationship is not desirable. And this slide basically shows you that 3 different neurodiverse individuals are using different pieces of the support in our program. And this one is basically telling us what the reason why they want to have the mentors like support in implementing strategies. Someone has new diagnosis, someone need more executive function support, creating schedule, pursuing positive habits, emotional support, etc. So the reasons for wanting the mentoring experience varies quite a bit. So with this, I'm going to just close and say that our neurodiverse college students have significant challenges in higher education, and there's specialized support programs that are implemented for students on the autism spectrum. There are also specialized support program for people with disabilities on campus. That's usually we don't really see that there are programs that are kind of in between, only for neurodiverse individuals. So either is for the students on the spectrum, or they are much larger. They are for students with disabilities, including the so-called invisible disabilities, using their terminology. And something that is very common also is that I haven't talked about in the last 20 minutes is most programs would want some kind of documentation on the need for the specialized employment program. specialized support program on campus. And we think that it is actually not helpful for certain students that actually don't want to disclose their diagnosis. They really don't want to be they don't really embrace their diagnosis, but they recognize their neurodiversity. So because of that, we actually in our program we don't require students to tell us about their diagnosis. They if they need to come to receive services, we'll provide to them. So we also use the strength-based model of neurodiversity at Stanford. There's a book called Neurodiversity, from phenomenology to neurobiology and enhancing technologies, that I just edited, and it's published now officially, so that will be a resource to talk about exactly what we mean by the strength-based model of neurodiversity at Stanford. And I'd like to thank the supporters of our program. And with this, I'll stop here and stop share and answer any questions that you may have. Fiona?
Thank you very much, Lawrence, for that. That was lovely. And I can see from some of the chats and questions that are come in, you have raised a huge amount of envy amongst the group. But we might get to that in a moment and think about what we can do about it. But before we go into the support system, can I just, you started off by talking about the prevalence of neurodiversity and the fact that it seems to be increasing. And certainly I know there had been some thoughts in the beginning from the academic perspective, and this was really looking at children who are accessing clinical services and trying to plan for clinical needs, that the prevalence rates in certain areas like California, Stanford, Palo Alto, were increasing hugely, and maybe, at a rate that was much higher than elsewhere. Would you like to say something in general about, do you think the prevalence of neurodiversity is actually increasing? How much of that is due to better awareness and people coming for identification that might then lead on to service supports? And comment about maybe the uniformity of that.
Mm-hmm. So the prevalence of autism, that's what I would be able to comment more specifically on. Neurodiversity with the other neurodiverse conditions, I don't have those numbers in my head, but if we focus on autism for a moment, the prevalence has been increasing in practically the last 30 years. The last two are measurements in the United States are rather similar. It seems to be plateauing a little bit in the last couple of years, at about 2% or so, roughly. And the increase over time in this period, from all the different studies, what we can say is that definitely there is increase in the diagnosis. Probably the awareness of the condition is making the parents want to know, and the pediatricians don't want to miss diagnosis, and the American Academy for Pediatrics also have required the pediatricians to do an assessment or refer for an assessment if the parents request. So this is a requirement. So basically, before that, 15 years ago, there's no such requirement. Pediatricians can misdiagnose and they don't need to refer. So definitely the recognition of not wanting to misdiagnosis can increase the prevalence. But what we believe is that that doesn't really add up. Even with the increased awareness, it's just not possible to account for all the increase in the prevalence. What we also know is that in terms of the heritability of autism, what's interesting is that about 50% is so basically the heritability now is, instead of like the 90% that we thought like 15 years ago, right now is more like 50%. So that really tells you that the environmental component is a really huge one. And who really knows exactly what the environment is doing to us in the short period of time. It's kind of difficult to say exactly whether or not this is really true increase in the prevalence in the kind of evolutionary point of view, because evolution takes a long time for things to change, take thousands of years for our DNAs to be changing and so forth. However, the genetics point of view, when we are looking at the reasons for having a genetic explanation of having autism, there is more recognition of de novo mutation, which basically the mutations actually come up the first generation in the in the autistic individuals, so their parents actually don't have those mutations. So what that means is that there is something that the environment is doing, and is also doing at the genetic level. So so what I can say is that the prevalence increase potentially is really coming from the environmental components that are not really clearly understood. There are a lot of people in University of California at Davis. There are researchers that are very much trying to answer questions about what the pollutants are doing and so forth. I don't think all of that can really give us a full picture, but what my opinion is that from what I've read from all the different literature, there is a high chance that the prevalence increase is real. It's not only from the awareness increase, and it looks like there is pointing to the direction of some kind of environmental component. Whether or not is because of the pollutants, we don't know. One thing that maybe I'll just point out is that there is a real exponential increase in the use of digital technology, and the digital technology change our world. And I can only speculate that from our experience in the pandemic, our behavior can change dramatically because of the environment, because of what we need, because of what we actually are able to do. Now we are using our digital technology so much, and we know that there's an association between the use of digital technology and autistic behaviors. So whether or not that actually is playing in as part of it, maybe some researchers are trying to answer that question out there. I don't know exactly what the how fast we can answer that question. Um, this is kind of what my observations are.
Mm. And Lawrence, when you take other conditions that fall within the neurodiversity spectrum, you mentioned dyslexia, dyscalculia, ADHD, and some groups would like to include more and more Tourette's, OCD. We know from the literature that there's rising prevalence in all of those conditions. So I guess it kind of really focuses our attention and our need to say that rather than having a very, very small minority that were accessing third level education, with the increase in prevalence and the recognition and the need to support access to education for more people, we're going to have more and more individuals falling within that neurodiversity category. Have you any idea from from the Stanford data, just as how many people might have disabilities? You mentioned some of the general details there from the States, with I suppose with high functioning autism up to 2%. But if you take the whole group, um, what percentage of the group entering college would you say have neurodiversity?
Well, in the ADHD population, for example, um, what we what we know is that um, the the percentage of ADHD is rather is much higher, as we know about the general prevalence is about 5 to 7%, and dyslexia is about 15% or so. So when we are looking at only the ADHD population going into college, the prevalence is very similar to the general prevalence. Um, so 3 to 7% of college graduates have ADHD.
Mm-hmm.
Dyslexia, or actually we don't know exactly, but learning disability, um, learning disability, it is including dyslexia, dyscalculia, um, and what we know is that about half of the students who are having learning disabilities, they would go on to college. So the number that I don't have it in front of me is exactly what is the percentage.
Mm-hmm.
If you just look at dyslexia, it's like 15%. I can only imagine that it's about 20%.
Mm-hmm.
Maybe if that's the rough estimate, and 50% of them has gone on to college, it will be about 10%.
Mm-hmm.
So I would say in the United States, it will be just about 10% or a little bit more. And if you add the autism piece, it will be a little bit more. So I would say it's probably going to be between 10 to 15% in a lot of the colleges.
And when you think of that very significant population coming to colleges, and the study you presented, where there are a lot of colleges already providing some supports, do you think that the supports up until now have tended to be much more focusing on learning difficulties rather than the much broader concept of engagement, interactions, quality of life, independent living?
Absolutely. I think in both the K through 12 education and higher education, most educators are really zooming in on academic achievements. So what they want to justify is if they are going to get good grades, then they are going to be good. What we really believe is that that's not good enough, even for the students that have good grades. Even with the students that are graduating from Stanford, they the neurodiverse individuals graduating from Stanford, not every one of them get a job when they are graduating. Some of them have PhDs and they don't get interviews.
Mm,
So we are really hoping that our neurodiverse student support program will be helping students to grow rather than and grow in a more holistic fashion rather than just getting good grades.
mm,
And in terms of the quality of life in the college years, that would be really different if we are able to help students to be balancing their life because they're in college, they're balancing between studies and everything else. And if they don't know how to do independent anything that's related to independent living skills, after they graduate, they can focus on work, but then at some point they really have to take care of themselves. So in the college years, we have 4 years to work with them. So that's why we think it is a very important time that
mm,
we potentially can help them with their growth overall.
mm,
Um, and that's something that's kind of forgotten in a lot of universities.
mm.
In our own university, the our leaders are very supportive of our approach of being more holistic, and I'm just very glad that we are really embraced with this idea.
Mm. I guess when you see performance and outcome, it's a very objective measure. So if you have students in the university that are struggling, their tutors may see failing grades and, that allows them to direct them to learning supports. The difficulty is for the other domains of their functioning. It's much harder for the tutor to have that concrete evidence. And in fact, you mentioned it, and there's many studies that have been done where, and it's the same in Ireland, even when students enter through the disability access route to education, there's a reluctance to identify themselves, certainly at the start, as a DARE student, and to be, reached out to and offered the supports. That's even less likely to happen on account of fear of stigma and being labelled. If the difficulties are in the area of mental health issues, ADHD related to interpersonal issues, what way do you think universities, or maybe Stanford has done this by your kind of multi-pronged approach, but what way do you think universities can try and anticipate, um, the associated broader issues if there's learning problems there, but also in somebody who actually mightn't come across as having learning problems because they're performing very well in that academic area, but actually the rest of their experience in college life is very unhelpful or very distressing to them.
Mhm.
How can the university, shine that focus a little bit more on, the other aspects?
Yeah, so what I think is that there you raise several different questions there, and one thing is about the stigma. Really, the students a lot of the time when they graduate from high school to college, they or even from like undergraduate to graduate school, when they come to a new environment, they think this is a brand new start. They start with a clean slate, and during the years in college or even in graduate school, this is really the years about identity formation, and they if they are trying to understand their identity, and if they embrace their identity as a neurodiverse individual or a neurodivergent individual, and then that will be fine. They may want to disclose their diagnosis to the people around them, but in my clinical experience, there are probably like half of the students that don't want to talk about their diagnosis,
Mm.
especially in their new environment. They don't know if it's safe, and they don't know if it's going to hurt them, because a lot of the experience with um, individuals on the spectrum sometimes is even traumatic. Some people get bullied because of their behaviors that are characteristics of autism. So, not needing, what my position is that not needing to require students to disclose their diagnosis is going to take away the burden, at least somewhat. And students come to, say, for example, at Stanford, if they got into Stanford, they typically have really quite high achieving, and
Mm.
they have a lot of things on their plate already. They really don't need to, they don't want to ask for one more thing that will be occupying their time if it's not necessary. So if they come to us because they really think we can help them uh, to grow better as a person in their formative years of development, they really mean to. And we don't really need to ask them for proof that they actually need the help. So what I think is that, at least in our program, we are making this happen. In other offices in our campus, uh, they some of them still need a diagnosis. So basically, what we are trying to do is to try to see if we can share our experience. We only have 2 years of experience running this program,
Mm.
but our other offices on campus, they have 50 years on campus. So we cannot, we're not trying to teach anyone.
Mm.
We're just trying to share like some part of the community that we know they really do better without needing to disclose.
Mm. Well, Lawrence, you've opened up a huge kind of excitement here on the question and answers. I'm going to ask maybe Beth initially if you could pose a couple of questions for Lawrence, and then maybe Ken.
Yeah, thanks, Fiona. Lawrence, we have a question here just about the focus of the project in terms of, obviously, you presented there on students. Is there any consideration of staff in the university who would be neurodivergent, and are there any particular, is there any focus around that or any advice around that?
Can you repeat the question again? Sorry, any focus on?
If there's also a focus on staff who are neurodivergent, and if so, what form does this focus take? Yeah.
The staff. Yeah, so absolutely. So we have a neurodiversity at work program, and we hire people on the spectrum on campus as well. And we also help other companies. We're building a pilot neurodiversity at work program for Google. We are doing this as the the if anything, the neurodiversity at work program effort is probably like a few fold larger than the neurodiverse student support program. We have spent a lot of time on that, and we want to help our own employees as well.
That's great, thanks. And just a couple of questions here about the peer mentoring program. What kind of training or supervision do the mentors receive, and would they typically be perhaps neurodiverse themselves?
Yeah, that's a great question. So they typically get 5 to 8 hours of training before they start talking with the mentees, the neurodiverse mentees, and in before the pandemic, all of those trainings are live, And during the pandemic, we basically have a combination of remote remote group sessions, and we also have videos that the mentors can look at, and then after that, after viewing the training material, we'll discuss with them, making sure that they really understand the material. Even before that, before the training, we interview them to make sure that they are people that are meant to be mentors. There are some, because the past couple of years we pay our mentors, and we don't want it to be just a job. We want the mentors to want to do it because they want to contribute to neurodiversity. So the second part of the question, after the training, what is the second part of your question? Sorry.
Would they typically be neurodiverse themselves?
So the first few were not, and now we're getting to the third year. Most likely we may have one or two that that were mentees before, and now they are interested to become mentors.
Great, thanks, Lauren.
Ken, would you like to pose a couple of questions from the audience?
Indeed, thank you very much. And I'd like to say on behalf of myself and ADHD Ireland, thanks Lawrence for the presentation. I have a number of questions, and the way chat has got on fire, it's very reasonable to say that you've interest and engaged a huge amount of people on this webinar this evening. But just going back to an early question that came in relation to your presentation from Angela, and looking at the support that you said students were looking for. And the first one you meant was academic coaching. So could you just maybe explain what you mean by academic coaching, and then how does it get applied to different conditions within the neurodiverse spectrum itself?
Mm-hmm. Yeah, so the academic coaching, so like in when students are in high school, they a lot of the time, at least for a lot of the students that are coming to Stanford or at Stanford, they before coming they sometimes also already have some kind of coaching. So maybe it's some kind of tutoring, and with different groups of neurodiverse individuals, there may be some need for more coaching of one kind versus the other, but more likely right now what the different universities are doing would be more for students that have executive function challenges. And sometimes there are also some programs that are related to like exactly what is the path in the major that the students would need to consider. So if someone is in physics, maybe it's going to be very different from someone in history, and they need to get different experience from the usually the staff members and sometimes the faculty members on exactly what they should be thinking about to develop their kind of choices to pick their classes and so forth. So for students that are on the spectrum, there are a whole bunch, maybe 15% or so, also have co-occurring ADHD, and ADHD more than enough time, the executive function on how to structure their time, how to prioritize their work, and how to try to figure out any accommodations that may be needed. All of that can be very helpful in the college setting. In the United States, when students are in high school, they have something called Individualized Educational Plan, and a lot of the time the teachers and the parents are involved, so the accommodations are all in place. However, when they are in college, all of that accommodations disappear, and it's not until the students are asking for it, they will not be automatically receiving them. So basically, one part of academic coaching that's very necessary would be to teach them on how to ask for the accommodations, because it is like really every single time that they are taking a class, they need to ask their professors on what they need. So so this is more of an issue for students on the autism spectrum. Um, Students with ADHD and dyslexia, maybe because their social interactions are relatively fine. So a lot of the time they can advocate for themselves, but I can see some students also have trouble in that area.
Okay.
Did you?
Sorry, another very quick question. Because of the nature of the topic that you're talking about, there's been an awful lot of input and questions coming from people in the education sector across the spectrum here in Ireland. And just sort of two questions coming out. I think it's one for yourself, Lawrence, maybe one for Fiona. A lot of people are saying the Stanford Neurodiversity Project is great. So the question they were asking for Lawrence was, is this replicable? How would it get transferred to other universities? And then maybe for Fiona, there's a lot of people saying, it'd be great if we could have something like this in UCD. So how would we go about doing that here in Ireland?
Well, we are really all for collaboration, and we like to teach other, consult with other organizations, very much similar to like the neurodiversity at work approach to a certain extent in the future. In the Neurodiversity at Work program, we basically teach organizations how they can build their neurodiversity at work program. I can see that in the future we can also do the same for the neurodiverse student support program. So even within the United States, there are a lot of community colleges and other universities that they are contacting us and trying to figure out what we are doing, and we are always willing to speak with them and tell them what we are recommending them to do if they want to do something similar to what we are doing.
Yeah.
So thank you for the question about that. And just to say that we are very much following Lawrence's experience and expertise and guidance, and UCD are very excited about the I suppose the multi-pronged approach, focusing on the individual student themselves, supporting learning, and the much broader aspect, focusing on the staff and increasing awareness and providing specific supports for staff to both pick up difficulties, but also to create a better fit for the individual. And then the third thing Lawrence was talking about, which we haven't started yet, but ultimately we would be moving towards, would be the moving on, both the transition into university and also the transition out of university, and linking up with job opportunities, internships, supported internships. I guess it's fair to say we're very much at a learning curve ourselves. Bláthnaid Gavin, who is the child and adolescent psychiatrist, who's kind of leading this with Beth, Ken, Aton and others, we, myself and Blonit, have come very much from a clinical perspective, and our understanding of neurodiversity up until recently has been very much from the medical model. So for us, it's important that we broaden our thinking about it, our own conceptualization. And we're doing that in the UCD project by initially meeting with other stakeholders in UCD. That's already happened, increasing awareness by way of giving some seminars and educational events. We've also set up a module in neurodiversity within the university, and that's live. And we have a number of people who are attending that. We're bringing neurodiversity, the concept of neurodiversity, much more and embedding it in other academic teaching that we do. So I teach medical students, for example, and last time I gave a teaching slot, I changed, the typical talk I would have done on autism and ADHD, very much more reminding ourselves about the strength-based models. So we're teaching ourselves, and we will also need to go back and, work with our clinicians as well to make sure that we're bringing the whole group along with us. I think that, we welcome your ideas about how UCD can do this at an Irish perspective, because just as I was talking to Lawrence in the beginning about the percentages, the prevalence, the demand, it really sounds like it's important to have both a generic support for students, being mindful of that. It's not just about learning and academic outcomes, but it's a much richer experience, which sadly, on account of COVID, Lawrence, I'm sure you'll agree, is missing for many of our students. So we're hoping that, that the university can take a very broad perspective on it, but notwithstanding individual additional targeted supports for individuals that might have dyslexia, or that might have ADHD, or that might have psychosis, or that might have autistic spectrum disorders that have impairments. So it'll be a combination of generic and targeted. So it's very early days to the group, just to say we're very passionate about developing this. Professor Deeks is also very passionate in UCD in supporting this, and hopefully, we will progress it and we'll continue with our discussions. I'm mindful that we've gone by our talk. I'm also mindful, poor Lawrence, I'm not sure if you've even had breakfast in California yet, Lawrence, have you?
I had cereal and coffee.
Okay, well, we're about to go into our evening meal here for many of us. So I might just end the session by thanking Lawrence very much for giving up his time, and indeed for spearheading the Stanford Neurodiversity Project, Lawrence, which we were fortunate enough to hear about and wish to emulate very much in our own university. I'd like to draw people's attention to the next speaker. Beth, if you wish to put up the slide there, it's by a speaker called Damian Milton. And Damian is an academic who is also, or writes as an academic autistic individual. And Damian has a son with autism and severe learning difficulties. So he will bring his perspective from an academic and his individual perspective. And I'm sure he'll be talking about the book that he has written, which very much shares the lived experiences of individuals with neurodiversity. So that talk is going to be on the 24th of June. It's again at 5 o'clock, and look forward to seeing many of you back there again. Thank you very much.
Thank you,
And
Fiona.
have a good evening all, and a good day.